Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome to another episode of AT Corner. We are fully sprinting into double digits now.
Lucky number 11.
I've never heard that saying before.
What are you talking about, 11-11?
Duh. So, naturally, I need to start off the episode like I do all the time. So we have a great episode, right? Isn't that true?
That's exactly how you start.
Which, by the way, we got some mail based on what I said about Chris Harrison last time. So now I'm just going to do the Chris Harrison thing every episode because I do agree, he is a national treasure. I'm 100% in agreement with that.
Thank you, Jen.
Yes. So we have a great episode because it's story time.
It is story time, and today we're talking about working within the healthcare team.
Yes, it's something that, the content of this episode is something that we've wanted to highlight for a very long time.
And something that really actually started this show. A lot of people don't even know what an athletic trainer is.
And vice versa, I think a lot of athletic trainers don't know about other health professions that we could collaborate with to improve outcomes.
This whole episode is going to be about mutual respect, staying in your lane, know your scope of practice, and challenge yourself to learn others' scopes of practice so you can really have the best patient-centered approach.
It's not a bad thing to go up to be like, hey, I'm not the expert at this, but this person is. Let's talk to them and see what they have.
If you're an athletic trainer, we're going to be talking about different healthcare professions. And if you are not an athletic trainer, why don't we just get started and explain what an athletic trainer is?
I think that's a good first step.
Yeah, spoiler alert, we're not personal trainers.
Thank you. I think it needed to be said.
So, if you want to go textbook definition, evidence-based, right?
I mean, that is part of the premise of the show.
We are healthcare professionals who prevent, clinically diagnose, treat, and rehab injuries and medical conditions in collaboration with a physician. But that's not all.
I was just about to say, sounds pretty cool, but I forgot. This isn't the intro.
My favorite part, of course, is that we're also first responders providing pre-hospital emergency care to our patients and athletes.
So I think it's time for our first story.
Yeah, let's kick it off. Actually, the first one I put in, we got through an Instagram message, which when I was looking for stories, I was asking around for stories and we put it out, and I was expecting actually a lot of negative stories about working with other healthcare professions, but this one is actually an amazing relationship between a bunch of different healthcare professionals and kind of an interesting relationship that the AT has within the healthcare team.
Nice, that's cool. And I feel like that's usually how it goes, like 9 times out of 10.
But those aren't the fun stories to tell. Usually people like to tell the negative
That
ones.
is very true. Those are the most memorable.
So anyway, this one's from Gabby B. She said, I've been fortunate with all other healthcare professionals I have worked alongside on the field, which is awesome. My head football coach is actually a physical therapist. He's amazing to bounce ideas off of. He knows when he's at football, he is coach and not PT. So he allows me to do my job with no pushback.
Oh my goodness, that is awesome.
And, get this, he is very understanding and supportive of ATs, so it has been awesome to work alongside him.
Nice, that's awesome.
Yeah. Talk about staying in your own lane.
And sometimes that is very hard for coaches to do.
I was going to say, normally that's difficult enough for coaches to do, not let alone someone who actually has the credentials to provide healthcare. Especially
if you work in the world of track and field. If anyone is out there who works exclusively with track and field, you know. And it's very weird to me because in track, you're supposed to stay in your lane while you're running. But I tend to see coaches running into everybody's lane.
Yeah, they want to be strength coach. They want to be ATs.
Oh, and the nutritionist.
Oh, yeah.
Some of them like to be doc, apparently.
But they're not this coach.
No, not that coach.
So anyway, she writes, I have a fire rescue crew that comes to football games. They're EMT type certifications, and those guys are amazing also. They sit back, watch, and say it's my show, and they will help if I ask and do whatever is needed. But I call the shots.
Nice, that's awesome. I wonder how she got to that point? You know, like, did she have to reach out to that company and, you know, discuss like, hey, here's what I do and stuff like that? I'd be very interested to know that.
I think also with over time with trust too, like I've seen this person work. I know that they're capable of doing this. I don't have to worry on my end.
Yeah, I agree. I think that's something that, you know, speaks volumes.
On both ends because actually the next story is about EMS too, but if athletic trainers know what EMS is capable of doing and if EMS knows what athletic trainers are capable of doing, that would be huge.
Yeah, and it makes everything go a lot smoother and everyone kind of knows where we're at.
This is still Gabby. She said, one game I had a physician from an opposing team who was in the stands step down onto the field during a C-spine injury. He allowed me to run the show, asked if I would feel comfortable, and allow him to do a quick exam. He did his thing. He said, you are doing everything right. I agree with you. Let me know if you need anything else. So I'm thankful and very fortunate with my encounter.
Man, she just had the whole healthcare team with her.
Yeah, really.
Like, that's awesome. That's so cool.
This is a perfect example of everyone staying in their own lane.
And not like coaches running zigzags on the track.
I mean, even with the physician who came down onto the field, that communication...
I was going to say, which that can turn into an ugly situation.
We have one of those.
I'm excited.
So the next one's about EMS as well, and this one's from Perry. And he actually posted this one, and I saw it. It was right before we started recording this, and I was like, we need to talk about this. This is actually perfect timing. Randy, you want to read this one?
Yeah, I can take this. So Perry wrote, you can teach an old dog new tricks. I like where this is going so far. Compound tib-fib fracture last night in front of goal. Firehouse is next to the soccer field, fully staffed. Parents present that agree for EMS to transport. I like to do nothing other than psychological first aid and hold manual immobilization. EMS started an IV and pushed fentanyl before applying a vacuum splint. In my opinion, this worked great for the patient who tolerated packaging with little anxiety. ATs do great with splinting, but in this example, it was better to wait. I'll be calling the firehouse on Sunday to once again thank the crew. Hashtag mutual respect. Oh,
there we
it's
go.
A common theme.
So I really like this one because it shows that, yes, I'm going to go through this and just say, what can athletic trainers do? We deal with compound tib-fib fractures. We deal with fractures. We deal with splinting. EMS started an IV. That's not something we do currently, or at least that's not something.
I hear it's coming down the pipe, but in general, no. Like, that's something that we really don't do, at least on the field.
Exactly. First aid is something that we do. Immobilization is something that we do. So it's really awesome. This is a really great example of, the athletic trainer recognized maybe the EMS crew has a better handle on this, and I'm going to complement their care with the manual immobilization, with the psychological, with the first aid.
Well, I think it also goes back to what you do in your comps, and as students, especially the students or newly certifieds that are listening, to remember when we did these scenarios where someone has a fracture like that, the first thing the person who's responding does is stabilize. Well, if you're the only one covering an event, you can't stabilize and, I'm going to splint too, right? So I think this story kind of speaks to the volumes of what's more important at that time? Well, me stabilizing and making sure this kid's okay, EMS is on their way. So I think it just shows, it supplements what we learn as students.
And in the traditional setting, you are going to know your patient and athlete way better than anyone who's coming down from the stands, anyone who's coming from the EMS crew. So to have someone talking to the patient, calming them down, telling them what to expect, all of that is so important, especially that comes from the AT as well.
So, speaking of EMS, my lovely wife here has had her fair share of experiences with EMS.
I have, because, just last football season, at the beginning of the season, 2 nights in a row, I did C-spine, send, whole package, send everything.
Just listen to that. 2 nights in a row, you had to do C-spine.
Mm-hmm. And Randy helped me with one of them.
That's wild.
Honestly,
I'm speechless. I'm sorry for the pause, but I'm speechless because you should have went to Vegas with those odds.
I know. Well, remember, it was almost going to be a third time. Remember that.
Oh, you're right.
And they were 2 different teams, too. It was just it was a
you
series of bad luck.
You should, instead of working the event, you should have went to Vegas.
No, because what if
true.
the kid had a C-spine injury without me there?
That is very true.
Actually, so both of those were actually in different counties because I was crazy and working multiple jobs with multiple hour commutes. That was a lot. So the first one was in one county and I worked with the EMS crew, which was amazing. Well, except they couldn't get through the gate. I think the EAP, the importance of writing EAP, that's emergency action plan for someone.
This episode has a lot of themes here.
Yeah. So ultimately the number one thing that they tell you have to do, write on the EAP about, any locked gates. Maybe someone needs a key. Yeah, the EMS crew got stuck behind a locked gate and we couldn't find the key. That was a problem. I remember, I think I was stabilizing for like 20-something minutes and my knees totally fell asleep.
I've had a preceptor before who's never done it to me, but made one of their students hold C-spine in the athletic training room for like an hour or so.
Why?
For situations like that, to be like, hey, you need to learn to...
This is what you do.
Yeah.
Honestly, in the moment, I didn't notice until I stood up and I was like, oh man, I can't stand right now. Everyone's looking at me. Those were pretty good. I can't complain. The second night, there was an EMS member who had a little bit of pushback, but we were very respectful with each other, so I was very pleased with how both of them went. But there was one experience I had when I was working with a performer, actually. I got called up to the stage, which honestly doesn't happen that often. I got called up to stage right, I remember, and I grabbed my little fanny pack. I've never been called to the stage before, and I ran up, not knowing thinking like maybe an ankle sprain or something, but patient was actually having an anxiety attack. So something that, as athletic trainers, that's something that we're fully capable of doing, and I had the situation completely handled. But before I got up there, the stage crew, the stage manager actually called me, the athletic trainer, as well as EMS at the same time. And because of where we were, it's very unique. We actually have nurses, physicians, EMS, everyone like on site. So EMS actually got there really quickly. So and nurses also came as well. So we had 2 nurses and 1 firefighter, I believe. I think he was from the firefighter crew. So I remember working with the nurses. It was great. I had already taken vitals by the time they got there. I had already started working on grounding work and breath work and, and trying to assess the situation.
Going through your checklist,
Exactly. So once the nurses got there, I was trying to transfer care. The nurses were very respectful. They didn't know what an athletic trainer was, but after the whole situation, they actually stayed later to talk to me about what I do, and then I got to understand a little bit more about what they do, because we don't really work with nurses on a normal basis.
No, not very often, no.
So, that's something that I do want to do maybe in a future episode too, sit down with a nurse and talk about what cool. The similarities and differences are too. But anyway, the firefighter was actually, he disappointed me so badly because you got to remember, we're working with performers. So he comes in and immediately takes over the situation, kind of pushes me out of the way, doesn't ask who I am or anything, just like completely pushes me out of the way. So while I was talking to the performer, the stage manager debriefed the firefighter on what was going on, and she just said, patient's having an anxiety attack. And I remember the firefighter turned around to his buddy and mouthed the word shocker, and with big like jazz hands, like
Wow, that's very unprofessional.
totally mocking the patient, which immediately turned me off. And then immediately as he took over the care and started talking to her and doing, the same exact thing that I was doing, it just made me so frustrated knowing that he's not there for the patient.
No, it just seems like another day.
Yeah. And that was the only negative experience I've had with EMS. So and I'm glad that was not my first experience with EMS. Otherwise, I think that it would have put a bad taste in my mouth.
Yeah, exactly. And I think a lot of people can have that experience with EMS. And with that, like you said, being there first, it really puts a bad taste for every other interaction.
Well, the same thing too. So, I had a great experience with those nurses that we actually got to talk to after that. But I had another nurse at the same location who, actually, shockingly, I had a performer with a cervical spine injury. Man, me and cervical spine injuries.
Yeah. I can't tell if that's lucky or
bad luck just follows me, I guess. But they all got the care they needed. So
that's right.
This one, actually, we had to fight for it. I was with another athletic trainer. The performer came in, and she had neurological symptoms down both of her arms. She was walking, and she had trouble swallowing, which, for those of you who are not athletic trainers, that is a cranial nerve that could have been possibly affected. So seeing this patient, already what I've explained to you, and even if you're not in the healthcare team, I think you would know those are alarming symptoms, correct?
Yes.
Yeah, so we called in the nurse because at this location, that was the protocol. So the nurse came in and she cleared the patient and said, you can go back to performing and you do not need to see the doc. Actually, she would not allow her to go see the doc.
No way. Wow.
Yeah, so then myself and the other athletic trainer had to advocate for, wait, she cannot go back. These are concerning symptoms. She needs to be seen. So after back and forth, ultimately the nurse had called her boss, or I don't know if it was her boss or the head doc, whoever was there, and for like a second opinion, and they were like, no, this performer needs to be seen right away. So luckily we were able to get that, and then we had to figure out transport situation, and it was a whole headache. But that really put a bad taste in my mouth for, this is another healthcare professional who is, one, not competent enough to take care of this patient, and two, not trusting another healthcare professional's judgment as well. So it was just a difficult situation.
Also, it just shows that the posters that come out for National Athletic Training Month are true. We are advocates for our patients because you just advocated for your patient for her good.
Yeah, I honestly, I don't know how anyone could send someone like that just on their way.
Yeah, that's pretty scary. Okay, so I've been looking down the list and I see OBGYN.
Have you read this one yet?
No, I have not. That's why I'm getting excited because I see it.
Okay, I'll tell you about it.
And I'm intrigued.
So this one's from Nicole L. She emailed us saying, I was a graduate assistant working in a local high school while earning my master's degree in the Southeast. One day at a girls' soccer game, an athlete fell to the ground and immediately began holding her shoulder in pain, screaming. When I approached her, she cried that she had heard a pop. Very, very common.
Yes.
I had just begun to palpate and noted an obviously tenting clavicle when a man appeared at my side and said, Hey, I'm a doctor. What do we have? Mind if I take a look? He lightly bumped into my shoulder, trying to get better access to my athlete, but I held my ground. I didn't recognize him. I replied, Sir, I have this under control, but I appreciate your willingness to help. Do you mind introducing yourself? I don't believe we've met. That's really hard to do in the middle of the situation.
And I was going to say, that's very nice.
Yeah.
I think that was an awesome way to handle it.
Oh, she approaches amazingly. He introduced himself and left out his specialty. When I inquired, he replied with a straight face, I'm an OBGYN. I remember blinking a few times and felt like my brain was a VHS that kept rewinding and replaying, trying to make sense of the situation. When I came to the conclusion that no, I'm not crazy for thinking this is crazy, I asked him to return to the stands, which, to his credit, he did without complaint.
I think once he realized he said his specialty, he was like, that does sound weird. I should just go back to the stands now.
But you know what? This is something that, like, a lot of times when I see people who have encounters with other healthcare professionals who come onto the field, it's oftentimes a matter of they don't know what an athletic trainer is. And something that I want to point out is this doctor probably saw, you know what, someone's hurt. If he doesn't know what an athletic trainer is, then you know what, I'm capable of assisting in this situation. You know what, I'm going to go help this patient. You know, yeah, he's an OBGYN, but maybe he did a rotation in ortho or something, you know? So anyway, like, I can see on his end, like, oh, you know what, someone's hurt. I need to go get my professional opinion. But again, going back to what we were saying before, if people knew what athletic trainers were, I feel like this would happen a lot less.
Oh, yeah, for sure. I would also like to note that I'm very surprised that this is our second OBGYN type story.
What do you mean?
The first one, I think it was a few episodes ago, where we talked about someone went to an urgent care.
Oh, yeah.
And it was said they were evaluated by an OBGYN. When it was, I mean, obviously...
At least that one wasn't actually an OBGYN.
Yes, but second time in 11 episodes where OBGYN comes up is very surprising to me.
Yeah, that is really funny. So anyway, I think that, first of all, this situation was handled amazingly.
Beautifully.
Great job, Nicole. I think it's kind of a bummer that he did push her out of the way, but it is good that he went back to the stands.
Yes.
Yeah. So speaking of physicians, we actually, as athletic trainers, collaborate with physicians.
Yes, and this next story, we were very excited about.
Yeah, so this one was actually, I know we talk about things being super exciting, but this one is really, really, really exciting because we got to talk to Rodney over the phone. This is someone who we've never met before.
Never met.
Someone we have met through the podcast. Someone in a different time zone than us. Someone who is equally as excited about promoting the profession as us. So, I mean, if not more excited.
I would say that's accurate.
So this was just an overall really, really great collaboration that we got to make, and
it kind of turned into an impromptu interview.
It did. So we actually have Rodney throughout this entire episode. The first thing we want to talk about is his experience with physicians.
In the beginning, I'll be honest, a lot of my orthopedic physicians did not know what an athletic trainer did or was. And that was shocking to me. I mean, I had 30 physicians, or almost 30, that just really weren't aware. I mean, some of them have met athletic trainers, but it had been, on the field, okay, I've covered a football game. Mm-hmm. I see you handling that aspect, but they never really seen us in the clinical setting. And so my goal is to show them that skill set and continue to build this practice and get more athletic trainers hired, get them in the physicians' offices, show them what value we bring, and just move that forward and grow it.
Has that experience with the physicians been mostly positive, or have you had any physicians who have looked down negatively on our profession?
I wouldn't say negatively. I would say because they didn't understand.
Makes sense.
Just because of the fact that, and I hate to bring this beating up a dead horse, but with the name trainer,
mm-hmm. Yes,
and then working in rehabilitation and working in a sports performance center, they thought all I did was, train athletes and get them, workout, basically, like a personal trainer, basically. And that's what
very common.
Yes. And so even for an orthopedic physician, and so explaining, hey, that's not what I do at all. This is our skill set. And so it took, I'll be honest, it took about 2 years to really just get them to understand. When I started doing rounds with the physicians, they actually started calling me a physical therapist. And I said, I'm not a physical therapist. So I appreciate it. I think physical therapists are awesome and their skill set's amazing, but I'm not a physical therapist. I am an athletic trainer, and this is what I do. And so you're not going to convince them all. You're not going to change their mind. They've been practicing a long time, but at least hopefully I can plant a seed and make an impact there.
Exactly. Promote the
Yeah.
profession, mutual respect for other healthcare professions.
Hey, it just starts with one, you know?
It does. You just have to make connections, right? You have to connect with people and show them that you care. And when you show that and show them, hey, I want to help you, but here's how you can help me as well. Let's be a mutual friendship and relationship here. And that pays huge dividends, in my opinion.
Nice. That's awesome.
So we were joking with Rodney on the phone that he is literally the center of the healthcare team because he's worked with so many other healthcare professionals. So we actually also got to talk to him about occupational therapists.
Yeah, I mean, that was something I was very intrigued about because I've never, personally worked with an OT. And so I'm not, 100% sure what their scope is and what they do. And I thought Rodney did a great job of explaining that.
So let's hear what Rodney has to say about working with OTs.
I worked with an OT at actually the pediatric hospital that I mentioned, Children's Health Andrews Institute. Miss Sarah, she was awesome. I don't know if she's ever going to listen to this, but I'll tell her. But she was actually a certified hand therapist, which is an advanced credential on top of the occupational therapist. And so there's been a lot of trying to make distinctions between PTs and OTs. OTs really work on those finite skills, learning how to button up your shirt, learning how to move your fingers and feel things, learning how to brush your teeth, things of that nature. And then that certified hand therapist is really like the top tier for OTs, where they're just working on that distal extremity of the forearm and the hand and really working on those finite motor skills within the hand. And they'll also do some casting and bracing to really help with the patient process, but they'll custom make that for the patient. And so say they need to take the patient into, extension at the wrist. And so they will place that patient there and create a custom brace for them, just to work on getting that patient into that extension, because a lot of these patients can't move their forearms, can't move their wrist. And so it's a pretty neat field. We hear a lot of PTs, but OTs, I don't think get enough credit for what they do. And so it's been a lot of fun working with her. I had to hold a patient one time, a pediatric patient, and I had to hold her forearm, and she screamed at me the whole time. I thought this little girl was going to hit me. She was 3 years old, and she did not like me holding her arm, but you had to do it to help the OT. You had to put her in that position because the little girl didn't understand what's going on. But once we got it handled, she felt much better because it was in a position of comfort for her. And so it was a fun experience.
So let's jump over to massage therapy.
Okay, I feel like that's something a lot of athletic trainers have come across.
With massage therapy, I think that a lot of people don't think of them as healthcare or part of the healthcare team, but if you really think about it, like, what they do is assisting the patient and going back to that patient-centered approach, how
best to treat that patient, and they can play a huge role in that.
Exactly. So Amanda M., who also messaged us on Instagram, wrote in and said, I am both an AT and an MT. So
which I feel like that is becoming more common, by the way. I feel like a lot of ATs are getting their massage therapy.
And she said she's a little biased, but there are certainly ATs that I can see working with MTs to work on soft tissue issues to get the athletes back into action a little quicker. As far as scope of practice as an MT, I don't make recommendations as to what a diagnosis is if the patient hasn't seen a doctor about the issue, even though with an AT background I could perform an evaluation. Those patients I would refer due to them scheduling for a massage and not an evaluation for an injury. Due to the dual credentials, when I am working as an MT, I try not to cross lines with my AT skills. As an AT, I am able to utilize my MT skills for purposes of sports massage to relieve the soft tissue restrictions. If I think the injury could use additional modalities such as hot stone massage or acupressure, etc., I would refer those athletes for a massage therapy treatment.
Nice. I think that speaks volumes to her philosophy and being able to not blur those lines and be like, hey, today this is what my role is. I'm staying within this scope.
Hey, do you remember when we talked about staying in your lane?
Yeah.
This is exactly staying in her own lane.
So we have two common themes. It's mutual respect and staying in lanes.
Yeah, stay in your lane. Next time you're at the doctor's office, try evaling a patient.
I don't
It's
think
not going to go over well.
I don't think it'll go well.
This also brings up a good point too, because not all healthcare professionals are a separate degree.
Oh yeah, that's very true.
And a lot of times, like you were saying with ATs and MTs, a lot of times the extra certifications athletic trainers do have.
Yeah.
So Becca B, who I went to school with before she was an athletic trainer actually, she just started working with a company that employs her as well as a functional movement specialist and an ART specialist. So do you want to explain kind of what does ART stand for?
ART is active release technique. So it's just a type of soft tissue technique that uses active movements with pressure from the therapist to help lengthen that soft tissue. I don't want to say break scar tissue because that's not true. You can't do it. So I think the more accurate term would be to lengthen the connective tissue and underlying muscle.
So they all work with local high schools in the area. So she wrote in saying, we work with the same patients and definitely approach rehab with a team approach because they're more experienced in getting patients to perform at a higher level when healthy than I am. I am more experienced with acute rehab, post-surgical rehab world. So sometimes it's hard because this is a new company and we're still figuring life out and how to work together in the most effective way, but it's a great experience because we provide so much to our patients with all three of our scopes. It's hard right now between COVID protocols and the current fire situation because the air quality is so poor. So we aren't all there as a team right now, but some examples that they've been like figuring out how to handle initial evaluations and who does what. They're working on defining their scopes of practice to make it more of a seamless process. She also told me that she's been teaching them how to tape just to have more hands for football season.
So they are making their own healthcare team.
I think that this is such an interesting role that she has because, I mean, a lot of times in the traditional setting, like day to day, you are just working with athletic trainers. Like, yeah, if you're lucky, you get a physician who comes on site once a week. If you're really lucky, you have a physician who comes on twice or more, like every day. If you're working cross country, you might have a massage therapist who comes out. If you have a team doc who's not a physician, like let's say you have a chiropractor or a PA, like that is a possibility too. But honestly, like to be able to work within your own healthcare team on a normal daily basis, that is insane. And I love that they're defining their scopes of practice early.
Yeah, that's going to save a lot of stress later and hopefully a lot of headbutting.
So speaking about another certification that sometimes athletic trainers get, or this certification can also stand on its own, it's an extra credential. We also talked to Rodney about the OTC
credential. And this was the whole point of chatting with Rodney initially, was to get more information from this, which was very valuable, and I was very happy to learn about who these clinicians are and like what they do.
And this is more popular in like a physician setting rather than like a traditional setting because it's more like casting, bracing, splinting, that kind of stuff. But I'll let Rodney talk about that. Before we get started, let's define what an OTC is.
All right. Well, I'll be glad to talk about that. And an OTC is a certified orthopedic technologist or technician, whichever one's kind of interchangeable. But the orthopedic technologist is a certified, specifically trained as an extension of recognized physicians that are involved in the musculoskeletal care of patients and assist in the treatment of the orthopedic patient.
So how much do they do in do they do patient assessment as well?
They can, but it's not really truly as extensive as what we do as athletic trainers. But they can do patient assessments more of like an MA aspect. So intake, blood pressure, taking some history, things of that nature.
So basically helps get the ball rolling.
Correct.
When they're being seen.
Correct.
And then what is your experience working with OTCs?
Well, I've kind of had a wide variety of experience with them. The main one originally came when I was working at a pediatric hospital up here in Plano, Texas. It was the Children's Health Andrews Institute, and they had orthopedic technologists there previously before I got there, but they were expanding that role, honestly. And just kind of seeing what they do. They actually had two separate rooms. And we could use a third one if we needed to. But those OTCs were on their own. They did all the casting and the bracing. They handled DME fitting. They would, take let's say a pin out of a pediatric patient's elbow after surgery. They would be on call with the physician if something needed to happen. They would be in the ER, at the children's ER, and so they had kind of a wide variety of expertise that was really unique that I hadn't been exposed to. But that's where I really got a lot of experience with them. And then we had a medical assistant who was also an OTC at the practice that I'm at now, which is Arlington Orthopedic Associates, and basically did all the physician's intake, saw the patient, roomed the patient. They would do all the casting and bracing if necessary, assist in surgery if necessary. And then I also met an athletic trainer who was an OTC at NATA and was teaching a casting and bracing course and just was picking their brain about it. And so there's been a wide variety of experience in kind of all different settings, to be honest with you.
Nice. That's really cool. What made you want to pursue the certificate yourself?
I think just because the value they bring, I love the physician setting. That's the setting I want to stay in. That's the setting I feel just most comfortable in and see my future in. And a lot of my physicians are wanting to expand the athletic trainer role here at the physician practice. And that's actually one of the requirements they're looking for, is having the OTC, because they do casting and bracing. They want that. DME fitting, they want that. Assisting in surgery eventually, they want that. And so that OTC credential really stands out. Now, of course, it's not a PA, it's not a certified surgical first assist or anything like that, but it gives you additional credentialing that's recognized by the practice or the hospital in another area of expertise, for sure.
Nice.
I don't know if you've said this before, can you define what DME is or what it stands for?
You say that and I can't remember it. Durable medical equipment. That's what it is. Durable medical equipment.
So DME is durable medical equipment.
Yes, ma'am. Yes.
Oh.
It clicked real quick.
Awesome. Well, that's something I learned that's new.
Yeah, see, look at that.
Yeah. And I mean, it's just a wide variety of things you don't think about if you're in your traditional athletic trainer settings. I've had to do a lot of learning just, oh my gosh, I didn't know we could do this. I didn't know OTCs did this. I didn't even know some of our MAs do the things that they do. And so I've learned from all of them, to be honest with you.
Can you name any specific things that you've learned working alongside OTCs or MAs for that matter?
For sure. The way they handle intake was a big one originally for me, being in a physician practice. Rooming a patient, taking a history that the way the physician wanted. They wanted a direct history. The patient is, example, 17 years old, right ACL, possibly a right ACL tear, complaining of pain throughout the midline of the tibial plateau, whatever it might be. They do quick assessments. That was really, I think, I didn't have a good skill set for in the beginning, and learned from the MAs on that. And it was just really unique. And all physicians are different. We know that, right? Every physician is different. And so every MA kind of had their way of communicating with the physician. So it made me a better clinician on my standpoint, learning from the MA and saying, okay, well, this is the best way to do this. This is the best way to take a history and be quick and efficient for that. Because it's all about efficiency. And on the OTC standpoint, definitely the casting and bracing. One of the aspects that I didn't realize is how much of an art it is. We talk about art and science and training, and how, when we do our taping, right? When we do our own fitting, whatever it might be of a SAM splint, whatever it might be. And it was neat to see how a lot of that translated over to the OTC as well. They used a lot of art. There is a science to it, because you're stabilizing a joint, you're stabilizing the area of the body. But it was fascinating to see, we pull tape. And that was one thing I was really struggling with. We pull tape to tighten. they lay their material. And so I had a kind of a struggle with that. They lay the cast material. You don't want to pull it and create too much tightness. And so other things like they can assist with aspiration and prepare injections for the physician. They can assist with wound closure. They can remove staples, sutures, things like that I didn't realize they could do, that I hadn't had a lot of experience with, and was just tagging along and saying, hey, I want to learn these things. And they said, well, let's go for it. Let's learn.
I think something about casting that you brought up. So I actually was fortunate enough to learn some casting in my master's degree.
Oh, and she loved it.
It was awesome. So much fun.
It's awesome.
But, something that stuck out to me when we were learning about it is, you tape someone and you're right. We pull the tape and it, if it's tight, then, they take it off after practice or, you redo it. But if if you have a spot in that cast that's uncomfortable, they're stuck with that cast until they take it off.
Yep. Well, it can cause further issues, right? You're not stabilizing the area, or you can create a blister or things of that nature. Like you said, we can take tape off, but you don't want to make a physician unhappy and have to reapply a cast, because that's a waste of time and money, to be honest with you.
Yeah.
So it's a lot of learning, but it's fun. Like you said, it's just fun to do.
So you kind of hinted at this already, but what value do OTCs bring, and how can ATs learn from OTCs?
Well, it's almost like, what value don't they bring? It's crazy, because they can really be an extension of that physician. Like I mentioned before, doing the intake and rooming a patient, casting, because we know that casting and bracing can really generate revenue, right? And that's you have to look at things from a business standpoint of, how am I going to bring value to this company? How am I going to bring worth, from my worth standpoint, as well as worth in their eyes and their mindset. And so, the casting and bracing is a great revenue generator if that's what your physician practices, right? And that's what they want. Other things is the DME fitting, the durable medical equipment that I finally remember what it's called. So, that's another revenue generator that they can do and assist with. All of our OTCs did that. And then, just being efficient in the clinic. Physicians want clinic efficiency. They already have a lot on their plate. They don't want to sit there and have to ask tons of questions. They're trying to care for many, many people. And so being that efficient clinician for that physician and OTC can really bring value with that. And then the other thing that really interests me, and this will be kind of that last point, is, in their scope of practice, an OTC can first or second assist in surgery. With proper training and education, they can do that. And I thought that was pretty neat. They can do traction, they can do things like that, but they can be that first or second assist in surgery, and then go on to get an advanced certification as an orthopedic technician, surgery certified. And so they can even go on and get that. And so, they bring a lot of value that I didn't realize in the beginning.
Oh my goodness, that's crazy. I did not know all that.
Yeah, it's a fascinating field that a lot of people just don't know a lot about.
And piggybacking on what you just said with, if you as an athletic trainer are in the physician setting especially, and you have this extra OTC certificate, then that physician now does not need to send the patient out to do what you can do.
Correct. So you're that one-stop shop, right? You are bringing a skill set that is, it's valued. It's just, I know we talk about value a lot in our profession, and you have to prove that. And so if you can be that, like you said, you're not having to outsource. If you can be the athletic trainer that also has this credential and, of course, knows how to apply cast, knows how to do that. That takes time and practice, just like anything. But if you can be that kind of one-stop shop, why does any patient need to go anywhere else? That's not a loss of a patient for a physician. And why does the physician need to outsource and maybe hire a surgical first assist for surgery? Why can't he utilize your skill set, or she utilize your skill set? And so it's being that well-rounded clinician. It's nothing wrong with gaining more skills, right? It's just another tool in the toolbox, but how is it going to benefit you and the profession as a whole and your provider? That's how I look at it.
Speaking of a one-stop shop, we have Bill who talks about working with USA Track and Field, which you want to intro this?
Yeah, so I think one stop shop describes it very well, because when you work on these teams or you work on at these events, it you're literally a healthcare facility. You have the athletic trainers there who, it's kind of interesting. What we do is we do the event coverage and we're out on the track, doing our emergency care and stuff like that. But then we're also in kind of like the medical area doing clinical stuff, soft tissue work, evaluation, so on and so forth. So we kind of do get the best of both worlds. But also there's physical therapists in there, doing their expertise. There's chiropractors there doing their expertise, massage therapists. There's even physicians there. So it's awesome because it's all in one spot. And, Bill will talk more about it, but it's all in one place. So if I see something as an athletic trainer that like, oh, you know what? This needs to see the physician, I can just go grab them. I can just go to the physician and be like, hey, can you take a look at this guy? Or, hey, you know what? I think you'll benefit from, I think you have a restriction in this joint. I could just go to the chiropractor. I don't have to like send them out or anything. So it truly is a one-stop shop.
Now speak for USA Track and Field. They do really create a culture of one team, one dream. Mm-hmm. Every time that we have a call, every time from the managers, coaches, you name it, it's all here for the good of the athlete. And that's one of the things that I love. And I'll just kind of like share those stories with, my fellow USA Track and Field professionals, is that everybody checks their ego at the door. There's a lot of people that are dual credentials. There's athletic trainers and they're dual credentialed and licensed as a licensed massage therapist.
Mm-hmm.
So we have a lot of those. We have ABC PTs. We have one of my friends, her name is Beth, and she started off as an LMT. Mm-hmm. And she decided like, hey, I want to be a PA. So now she's a PA. It's like, and so we have all these dual credential people, but then also like myself, I'm a single credential. Mm-hmm. I have a lot of experience with the soft tissue work just from what I've done. But like mentioning how you guys were talking about like, hey, we're working with an athlete, but we see that I can do so much in my specialty, which would be the biggest benefit to that athlete. And then we realize like, oh, hey, maybe there's an adjustment that's needed. Maybe that's necessary. Maybe we have some restriction. We have some lack of mobility. That's going to be that piece that's going to help them improve. We're going to get a good patient outcome at the end of the session. Hey, so-and-so, hey, do you mind taking a look at this individual? Maybe they may need an adjustment. Tell me what you think. And so we are very good as far as understanding what our limitations are and also what our strengths are and understanding of like for the betterment of that athlete, who do they need to see so that when they come out of medical or they come off your table, that they're like, I'm good to go. I'm in tip-top shape. Thank you guys. It's not one person needs to save everybody. When you have people that want to be at that level, like to have the cowboy to save the day, that's the worst kind of person that you want to have, because you got to have a team. You got to want to be a team player, and that is, I think, the beauty. There's a beauty about it. And this comes like in the art of it. Because I've seen people that come in and, this is what I've done and this is what research says and and they're very like, it's a narrow scope, of what they can do to provide services for an athlete. And, to push out like on our staffs and some of our big staffs, we have like 15, 20 people and all ranges of expertise and experience and knowledge and, to not have all of those resources available for an athlete who's there to win a gold medal, and that's at the end of the day, what we're there to do is we're there to keep them healthy. We're there to keep them at an optimal level, at a high level of performance. So everything's got to be clicking, because at the end of the day, when we're at the Olympics, we're at a World Championships, as the medical staff for Team USA, we need to make sure that those athletes get what they need so they can compete for us to be on the top of the podium at the end of the day. However that's done, it's we just need to come together as a team. So there's been great times where I've had like a chiropractor, hey, Bill, can you do some soft tissue work? This is what I see. This is some soft tissue restriction. You're going to be great at it. Do you mind taking a look and not tell me what you think? Great. Take a look at that person. Okay, cool. We can do this and X, Y, and Z. And it's like, okay, send it back to the chiro. Chiro's doing some adjustments, maybe some ART. And then all of a sudden in the middle, like, hey, this sounds kind of weird, like, hey, our MD, we'll bring our team physician over. What do you think?
Mm-hmm.
Yeah, well, let's look at it. And whip out a diagnostic ultrasound that he happens to have in his bag. Hey, let's take a look. It's things like that. And then at the end of the day, like after all that, we may have like, they're pretty frazzled. Maybe they're stressed. Maybe like, oh my gosh, like this is something that they found. Like, oh my gosh, I have quarterfinals, tomorrow, and what I'm going to. So then, hey, we have a sports psychologist. Hey, so and so. Hey, can you talk with this person? Oh yeah. Or they're just hovering around, and they're just kind of in the wings. And one of my good friends, I'll name drop Dr. Tracy Statler. And that's many times I've seen her do that and work alongside with chiros, athletic trainers, massage therapists, ADC PTs, and MDs. And it's like, and also too, we have our nutritionist. Her name's Alicia Kendig. She's from USOC, and even from like a nutritional standpoint, nutritional standpoint, sorry. Like it's just like we all come together.
Again, mutual respect.
Exactly. And I was talking to someone on our Instagram. Man, our Instagrams have been busy. I was talking to a dual credentialed chiropractor athletic trainer, if I'm remembering correctly. His name's Austin. And he said the only time it doesn't help is when pride and ignorance get in the way. No matter the professional, multiple minds and views are better than one.
And I think sometimes that, that's true. It's just, you get so caught up in like, okay, I know what I need to do. Oh, I got this. I'm familiar with this. Let me do this. Sometimes you get lost in that. Going back to what Becca said, like, she knows that she's good with the acute, with the post-surgical, all of that. But, when the athlete's healthy and they're trying to improve their performance, maybe that's someone else's domain. Yeah, so I see on the list that we have a quick little preview of an upcoming episode. Yeah, so this one is perfect because we talked to Scott, who is dual credentialed PTAT. He doesn't talk about that in this next little clip. He actually talks about another one-stop shop healthcare team that he actually talks about too, when he worked the US Open skate and BMX in Huntington Beach, and then also when he worked USA Judo.
We had chiropractors, we had athletic trainers, we had PTs, we had MDs, right? Mm-hmm. We had an MD that was ultrasound certified, so he had ultrasound on deck. Nice. Right? So being able to see that interdisciplinary like collaboration is like legit. It's like super fun, right? Because it's like, all right, this person just fell off their skateboard. Boom. Or they're probably spasmed out. They probably needed an adjustment by a chiropractor. Oh shoot, this person freaking hit their head. All right, where are the ATs at? We gotta do a referral. All right, ATs, go. This person fell, busted open their knee. All right, MDs, let's go. ATs first, basically on site, and then we refer out to the MD. MD does ultrasound, determine if it's fractured or not, and then they stitch it up. If it's fractured, they refer out. Right, they have their own imaging and all that. Right, so you skip the middleman of like transporting and all that stuff. You have everything on there. Right, so that's with that event in Huntington, right? And I've gone through other events where it's like working USA, like USA Judo, USA Taekwondo, right? All that stuff. Or yeah, USA Taekwondo and Judo. We got nurses on staff. We got MDs. We got casting. We got PTs that are doing dry needling. We have everyone. We have ATs on deck, right? And that's a huge triage as well. And I thought that was awesome to see. We also had chiropractors, right? So everyone was working in their own realm. We knew what everyone's scope of practice was. Mm-hmm. We knew when to refer who was good at what, and the amount of care was exceptional. And I feel like we don't see that a lot in our AT profession, as well as with PTs. And I think that PTs need to start to step it up and go into that realm and really stop being stubborn and thinking that ATs are just the ones that work in gyms. And they need, or like, oh, these are what chiropractors do. All they do are adjustments. No, like some chiropractors are legit. They know that after doing an adjustment that you can focus on utilizing that new range, moving into that painful range that is now pain-free because of the adjustment, right? I think that's awesome. That I felt was a good experience for me and gave me a better appreciation for other healthcare providers.
So we kind of already previewed this before, but we actually sit down with Scott for the next episode as well, and he's going to talk more specifically just about physical therapists and athletic trainers and what they can learn from each other.
So if you liked that little tidbit, we have more for you on the next episode.
And I know we really, really try to keep our episodes under an hour. Our original goal was to make 30-minute episodes, but honestly, we have so much to say that it was just so hard to keep it at 30 minutes.
And also, we've gotten a lot of interaction. A lot of people within the community have been contributing, and it really, we get thrilled every time we get something.
So we know that we did not even touch the tip of the iceberg of the healthcare team. There are so many more that we didn't even name, like PAs, MAs. Oh, we talked about MAs.
Yes, we did. Oh, yeah. We didn't.
Rodney did. So we want to know, have you guys worked with other healthcare professionals? I know you can't comment on this episode, unless you're watching us on YouTube, but you can comment in our Facebook group where we post episode threads for every episode. So go ahead and head over there. The link is in our show notes below. It's also facebook.com/group/AT Corner podcast. You can join our AT Corner community and network with other listeners of the show. And this is actually also a perfect plug for our promo code with MedBridge. All caps, AT Corner, one word. It's $175 off continuing education courses. And it's not just for ATs. It's for way more in the healthcare team. There's courses for ATs, PTs, OTs, RNs, and speech language pathologists. SLPs.
So after our interview with Scott, what do we have next?
So if you guys are new, we do every other episode with stories and education. So this was a story episode where people send in their experiences working as an athletic trainer, and next episode is our education. So some of the upcoming story episodes that we need your stories for are concussions, hydration stories, cryotherapy stories, and getting injured on the job.
I'm going to be very intrigued to see what stories come from that.
Yeah, when the athletic trainer who takes care of other people gets hurt.
It's just an oxymoron.
It really, really is. So anyway, I think that's it.
Thank you for helping us showcase athletic training behind the tape. Bye.